My name is Carolyn Yakish, and I'm the Premium Experience Manager at Thomas Eye Group. I first want to apologize for our technical difficulties yesterday for many of you that were trying to get on, and we were sort of two frozen people. And so we decided to reconnect this afternoon and redo the webinar so that we could send this out to each of you that were trying to get on it yesterday, because it's such a great topic. Obviously, it's on skin rejuvenation, and I can say for many of us that work at Thomas Eye Group, it is one of our favorite departments because every time we walk in here and leave, we look a little better, and we keep coming back as Dr. Neufeld and Rhonda's patients do. So Dr. Neufeld, welcome today while we're not frozen.
Good morning. Thank you. Thank you.
Yes,
I also just wanted to second Carolyn's apology. We've all been on the receiving end of a frozen Zoom presentation and understand the frustration on it. So we apologize, and hopefully today will make up for it.
Absolutely. So I thought we could sort of start, Dr. Neufeld, and you could share with everyone that is watching this today, sort of like why you decided to go into oculoplastics.
Sure. My theory on why, I guess my theory, but my desire and need when I became a doctor was to get as specialized as I possibly could. And I sort of, the idea of being a general sort of jack of all trades wasn't something that really felt at home for me. And I really wanted to develop like a niche that I could really become the expert in. And something as narrowed down as, eyelid and around the eyes seemed pretty niche and pretty specialized. And to me, that was where my focus was. So that's why I did it.
Yeah.
That's how I ended up there, I should say.
Yes, and we're glad you have. Let us know what offices that you see patients in.
I see patients out of our main office, which is in Sandy Springs on Hammond Drive. And I also see patients in our Gwinnett offices, one in Swanee and one in Lilburn.
Okay. So obviously everyone knows we've been in this COVID situation for the last 5 or 6 months. We closed for a little while and we're seeing emergency patients only. And now we've obviously reopened all of our locations. One thing that we definitely have learned through this time is there's little gifts and pockets of goodness that happen and change that can happen. And one of the things that we decided as a team is to do more patient education on these Zoom and webinars as you are in your homes, maybe a little bit more time some days. So many people are working at home, and also in the comfort of your own home, you can watch webinars. And Dr. Neufeld, I was wondering if you could share with everyone that is viewing this a little bit about the precautions that we are taking to keep them safe, our staff safe, and our physicians safe.
Sure. Well, we are here at Thomas Eye Group, we are adhering to and usually over and above any of the safety precautions and protocols that are dictated by the governing authorities. So whether it's the CDC, the World Health Organization, Northside Hospital, we're sort of taking all those into consideration and usually going a couple of steps above that. Everyone in the office, staff, doctors, patients is required to wear a mask at all times. The surfaces that anyone can ever have a possibility of getting around are cleansed with disinfectant before and after every single patient. Housekeeping and our cleaning service has got a ramped up, more sort of deep disinfective type of cleaning regimen that is implemented on a routine. Temperature checks, questionnaires, things like that, and a whole lot of behind the scenes type of work is done to ensure that not only our patients, but our staff is as protected as can possibly be.
Yes, absolutely. Thank you for doing that. So on that note, I think we could go ahead and get into your presentation because I know people are very interested in this. And I know a lot of my friends have been having procedures of all different types because one, they've got a little bit of extra time, and two, it just makes you feel good about yourself.
Sure.
So I will give the floor to you.
All right. Very good. Let's see. Give me 1 second. All right. So This talk is going to be about a procedure that we have formulated and come up with here. And we call it the laser trifecta. And this is sort of not a commercially available laser or a procedure. It's something that we developed here, and we gave it that name because I think it describes the components that we're trying to achieve and trying to encompass in one name. So laser trifecta. And what it is, hang on one sec, there we go. It's 3 treatment modalities, and those consist of what's called a nano laser peel, BBL laser ablation, and microneedling. After that, we treat the patient with PRP, which is called platelet-rich plasma. And I'm going to discuss each of these components a little bit more just so everyone can have an understanding of the benefits that they can provide and how we incorporate these into a single setting office treatment. So the goal of this treatment is to target several different problem areas of the skin in one treatment session. Minimal downtime was a goal that we were trying to find, as well as minimal discomfort, and to have something that we could do here in the office and not have to go to the operating room where deeper levels of sedation and expense would mount up, making it prohibitive. So the first component we talk about is a nano laser peel. Nano is just relates to the depth of the laser. And basically what it's doing is pretty much power washing the skin. It removes the superficial dead cell layers from the surface of the skin. And we can tune how deep or superficial we utilize that laser to go. And it's just in terms of microns, which is just a depth of tissue that are removed. And the laser basically vaporizes that tissue immediately. It takes just 1 or 2 days to heal up from that, and some mild redness may persist afterwards. This helps the sheen or the sort of the luminance or the texture of the skin a lot, because if you think about it on a microscopic level, the skin's got these undulations in it from some dead cell layers, and when light reflects on that, it scatters it in different directions because it's an uneven surface. When you do a laser peel on it, it makes it a more uniform surface, and so the light will reflect in a different way, a more uniform way. And that's what people sort of come out after a laser, and they sort of have a glow or a brightening to their skin, and that's what it's due to. The next component is called a BBL laser. In BBL, it stands for broadband light. And what this is a laser that targets tissues that are deeper than the surface of the skin. And so if this is the surface of the skin, the laser will penetrate and have a target tissue underneath the surface of the skin. And the target for this laser is anything that's red or brown. So tiny little capillaries or blood vessels, sunspots, which are or different types of pigmentation that may exist in the skin. And all those reside beneath the surface of the skin. And this is a way to get to it without injuring or damaging the skin in order to do so. So what happens is the laser energy, the light energy, is absorbed by these pigment cells, and they eventually then come to the surface and are shed off within the course of about a week or 2. So after this treatment, these sunspots become darker as they come to the surface, and then they're gone after about a week or 2. The third component is something called microneedling, and what microneedling is simplistically, you're injuring the skin. You're injuring the surface of the skin to elicit the body's healing response to it. The particular type of microneedling device that we use has 12 tiny little needles in it, and these tiny little needles basically punch tiny little holes into the surface of the skin, inducing what's called microtrauma, which is basically stimulates your body's healing system to fix itself by making new collagen and new skin cells. And so the texture and the tone of the skin becomes rejuvenated that way. This is great for people who have acne scars because it helps your body remodel those scars, fine lines, and just sort of a ruddiness or an unevenness of the skin because it just heals itself. It's utilizing the power of your own body's healing system to really help itself. So those are the 3 components of the mechanics of this trifecta treatment. All right, again, nano laser peel, BBL, and microneedling. After that, what we do is we take some blood from the patient's arm, tiny little bit of blood, and we spin it in a machine called a centrifuge. And what that does is it separates the blood into its various components. The component that we're looking for is the plasma, because within the plasma resides platelet cells. And these are cells that are normally used to help your blood clot, among various other things, but that's the main function of it. But what we've found, or what science has found, is that there are growth factors and healing mechanisms involved in these platelets that help the body heal. So this has been used for many, many years. This is not a new concept. It's new with regards to rejuvenating and helping skin and helping wounds heal. But tendon and muscle injuries, this is commonly used in orthopedics to help athletes who have tears or sprains in muscles or tendons due to that reparative growth factor assistance with your own body's healing. So we both inject it into the skin and massage it into the skin after we do this in-office treatment. I'm using it also during my surgical cases to help with incisions and wound healing after we're doing various reconstructive facial procedures or eyelid surgery, such as ptosis or blepharoplasty. Now I'm injecting PRP in that, and it really speeds healing, decreases scars, and keeps inflammation at bay. But as it pertains to this procedure, the laser trifecta, it helps every one of the components function better. It's almost like a turbo to the above process. It decreases redness and swelling and helps you recover that much quicker. All right. So the procedure itself is an in-office treatment room. Again, there's no operating room setting necessary. Topical numbing cream can be applied in advance if the patient desires, and the entire process takes about an hour, start to finish. The skin is red for a day or two and pink for about a week after that, and you can put makeup on the next day. Ibuprofen is really the only kind of pain medication that's necessary. Patients don't need anything stronger than that. There's no need for narcotic painkillers or anything after this procedure. So this is a quick video that was made, and a couple notes about this video. The first thing is that, number one, it was made pre-COVID. So you'll see sort of some protocols, health standards that aren't exactly what's done now, but that's just a note that's not standard. That's just for the purpose of this video, because it was done in a pre-COVID world. And this patient is Carolyn, who you met earlier on this webinar, and you'll be able to sort of see how she did with it, and if anyone has any specific questions, that she's always available to answer that specifically. Okay, so with that, I'm going to play this video. I believe it's about 3 minutes in length. You gotta be kidding me. Gotta be fucking kidding me. Oh my God. Hang on just a second. Hi, I'm Dr. Kenneth Neufeld, oculoplastic surgery. Here at Thomas Eye Group, today we're going to be doing a laser trifecta outpatient procedure. The laser trifecta is a great cocktail of procedures that we do at the same time to really refresh, regenerate, and really redo the skin. Any patient is a candidate. There is minimal to no downtime. The skin can be red for a day or two. You can put on makeup immediately afterwards and go right back to work. Patients love this, and it is a way to get a big bang for not a lot of downtime. Hope you enjoy.
Hi, my name is Rhonda Skipper. I'm the clinical coordinator here at Thomas Eye Group. I wanted to introduce the trifecta treatment that we offer here. The trifecta treatment consists of 3 treatments. We have the Nano peel, we have the BBL, which stands for broadband light, and we have the microneedling. Today you'll watch me perform it on one patient, and the first thing I performed was a microneedling. So looking at your skin, you have good tone and texture, but I noticed there's some pigmentation. So besides the pigmentation, what are your goals for me today?
I would say to clean up my face, because I haven't done much of anything in about 2 years. I do feel like there's a little bit of like sun damage and maintenance that needs to be done, and a little bit of brightening.
Okay.
Okay.
Well, with this procedure, what's going to happen is there's 12 fine needles and it's going to rejuvenate the collagen, basically. There's minimal downtime, 1 or 2 days.
Okay.
The main thing you got to do is keep it clean and moisturized. Okay?
So when it comes to wearing makeup again, can I wear a little bit tomorrow, or is it best because I don't have to wear it tomorrow just to leave it off?
No, you can wear it tomorrow. Absolutely.
can.
If you want to
Okay.
leave it there, you can. A lot of people say no, but you're fine to do that.
Okay. And about how long does this take?
This takes only about 15 minutes. Just depends on how many passes that I do, and that's the key to microneedling.
Okay.
Is the number of passes.
Okay.
Okay.
And how many times should I do it, and time frames?
We recommend 30 days apart, so that's in 3 treatments, 30 days apart.
3, 2. Okay.
How do you feel?
Great.
Okay. 1 second, we'll do it over. Okay, so the next procedure we're going to do is called the Nano pill. And what the Nano pill, it like deep cleans your face. It's almost like you see someone power washing their sidewalk and it deep cleans without breaking it. That's what we're going to do to your face, okay?
Okay.
Minimal downtime.
Okay.
You'll be red like a sunburn. Other than that, you just need to keep it moisturized.
Okay.
Okay? So we're going to do a little test spot right here.
Okay.
So here we go. Ready? Right there. The next one I'll do is a broadband light, which is BBL. And what that works on is the browns and reds as well as anti-aging. It's just a lot of light that's pulsed down in the skin that rejuvenates the collagen as well. And the nice thing about the Trifecta, you get it all done at once.
Yes.
And the results, minimal downtime.
Yes.
Perfect. Okay, we're done.
Okay. Sorry about the technical glitch there, but we're glad we got it figured out. This last photo that I want to show is Carolyn. And here's her right after the procedure. And just to give you an idea of how you're able to function in terms of its downtime, which I think is a big component nowadays, is that she sort of took the liberty, went out and had a good time with a nice glass of champagne and put some makeup on and seemed to be doing just fine. So it's not a big knock you out of commission type of procedure, okay? My assistant, her name is Rhonda Skipper, and she is wonderful, and she does more of these types of lasers than most people around, and she's got a tremendous amount of experience and can really, really, really give patients a great experience here in our office. I'm going to introduce her and let her answer a few questions, but this is her contact information, and she'll be happy to get back to you and provide any answers to any questions that you may have. Hope you enjoyed, and I appreciate your patience, and we look forward to seeing you soon.
Hey, Miss Rhonda.
Hey, Carolyn, how are you?
I'm good. Every time I see those videos, I get excited because it was just such a great experience. So when I was thinking about this and talking with you a little bit today, I have to tell you, and everyone watching, when I met Rhonda, I sort of wanted to follow her around like a kitty cat at the office because of what you do and how awesome you are with the patients and, you know, the results that people are getting. I've always said, you know, people come out of your department looking better than when they walked in. And sometimes there's some healing time like we see. And can you tell everyone watching this today, like how many years you've been doing this and, you know, what sort of inspired you to jump into aesthetics?
I've been with Thomas Eye Group almost 10 years. I've been doing the laser about 7 years, and I love it. I love my job. I love patients, you know, get the results that they desire. It just makes me feel complete, happy.
Yeah. Well, you make them very complete and happy. And I thought we could, since we don't have a chat room and we're videoing this right now, I thought I could ask you a couple questions. And that is about how much downtime can a patient expect after having the Trifecta?
Usually 1 to 2 days are red and peely, and then a week after that they are pink, but you can go back to your normal routine, exercise, work. It's not that much downtime.
Yeah. And would you recommend people hydrating a little bit more?
Absolutely. Always,
Okay.
always.
So I laugh when I sent you those pictures because by no means, I do want to say this, I forgot about this event that I was supposed to go to the next day and there was champagne. And as I'm drinking the champagne there, I'm like, I know I shouldn't be drinking this because, you know, I'm in healing, but I drank a ton of water, so I don't want to be in trouble with you, okay?
But it was so good, right?
It was so good. And the next question I was going to ask you is how many treatments, because I remember talking to you about this, how many treatments and how do you figure out how many treatments the patients need?
You'll see results after the first treatment. However, this depends on the condition of the skin and their genetics. I mean, everybody's different. You can come in with, good skin and it only takes, up to 3 treatments. Sometimes you come in with just okay skin. It takes 3 to 5 treatments. So it all depends on the condition and your genetics.
Yeah, and I can tell everyone that's watching, I had 3 treatments. So I started, I believe it was October of last year, and we did one in October, one in November, and one in December. And I do remember, especially, I remember a day I went to an event when all this was done, and people are like, what did you do? Because it's always that like slight, like I didn't have a facelift. I didn't have, something that was like but they're like, you just look really refreshed. And I remember having these conversations with a lot of my friends.
Carolyn, when we see women with something being done to their face, we want to know what it is.
We do.
We have to,
We do. Well, and you know what's funny, Rhonda? I remember that evening I had gone into Whole Foods and I had all the Aquaphor, like that one picture, and I looked all goopy and, I had my hair back and, people were asking in there, what did you have? And I'm giving them my card. And I was sort of cracking up just with what you said. Women want to know, like, even though I was all red and, like, what'd you have?
I have no problem asking when I see someone with, redness or anything. I'll go up and ask, well, what'd you do? Let me know.
Yeah, I know. It's like, we are all the same with that. I was thinking, could you share what the September special is for people this month?
Oh, sure. The Trifecta, you purchase 2 and you get 1 free, which is a great special. The Trifecta is $1,200. So you're getting 3 for, $2,400, which is awesome.
Yeah, absolutely. And then a question I'm thinking patients might have, do they call to schedule this or do they call actually to schedule a consultation with you first?
A consultation with me first.
Okay.
We need to look at the skin and that way I can give them some kind of, tell them how many treatments I think that to reach their goal and just give them an idea what to expect.
Yeah. Okay. Wonderful. Oh, how long is the consult about?
It's about 20 minutes. You're in and out. It just takes you a few minutes just to meet someone, look at their skin, answer some questions or ask some questions, and from there you're good to go.
Okay. Well, awesome. Thank you so much, Rhonda. It's great to see you. And I just want to let everyone know if you would like to call or contact Rhonda, the number is 844-ATL-RENEW, or feel free to email her at Rhonda, RONDAS ThomasI.com. And again, thank you to everyone. And we appreciate it. And we look forward to seeing you soon. Bye, Rhonda.
Bye, Carolyn. See you later.
Okay.